Welcome to this explainer. Today we're doing something a little different. We are opening a formal, evidence-based investigation into what honestly looks like a severe collapse of emergency medical services in Madhya Pradesh, India. Look, when we think of an ambulance, we usually think of a sanctuary on wheels, right? It's a vehicle literally equipped to save lives during those critical golden hours right after a medical emergency. But what actually happens when the very system designed to rescue you becomes an added layer of trauma? We're going to look closely at a recent, highly viral incident that shocked the nation, and then we're going to pull the lens back. We'll use the data and reporting to map out whether this was just one bad actor or, as you'll see, a symptom of a much larger systemic breakdown.
Here is the dossier we're opening today. First, the Katni incident. Then we'll look at the official probe, open up a chronology of past failures, and finally synthesize the systemic breakdown.
All right, let's dive right in. Section 1, the Katni incident, a viral shock. So picture this. It's April 2026 in the Katni district of Madhya Pradesh, and a deeply disturbing video starts circulating like wildfire on social media. It isn't a video of an accident itself, but rather the grim aftermath taking place inside the very system meant to help. What's truly visceral about this footage is the reality it exposes. You have a woman, Pramila Barman, whose husband is fighting for his life inside the vehicle, yet she's outside, physically washing the ambulance. And she's not doing this voluntarily. As the reporting notes, she points directly to the driver, making it clear she's cleaning the vehicle purely on his strict instructions, while he just stands there watching her.
Let's methodically break down the facts here so we can really grasp the human element. The victim is 32-year-old Rahul Barman. He was critically injured in a severe road accident near Kerala village and was brought to the district hospital in a publicly funded 108 ambulance. He's in such bad shape that doctors immediately refer him to a facility in Jabalpur for critical care. It is during this desperate, life-or-death window that the ambulance staffer, identified as Mohit, allegedly steps in. The allegations are twofold here. First, forcing the patient's wife to do manual labor by washing the vehicle. Second, demanding extortion money just to transport a dying man. I mean, just think about that juxtaposition for a second. Cold extortion against a family's absolute terrifying desperation.
Moving on to Section 2, the official probe, demanding answers.
As you might expect, visuals of a woman washing an ambulance while her husband bleeds out generated immediate, massive public outrage. The authorities absolutely had to step in. Taking direct cognizance of the viral video, the Katni District Hospital's civil surgeon, Dr. Yashwant Verma, issued a strict notice. He demanded that both the 108 in charge and the ambulance driver provide a satisfactory explanation for this horrifying event within exactly 1 week, warning that strict action would follow if they failed to do so. But an isolated probe leaves us asking a much bigger question. Are life-saving systems becoming a burden on patients' families? This is where we need to pivot, because this isn't just about Mohit, the driver in Katni. If the very infrastructure funded to transport you safely during the worst day of your life is instead extorting you, we have to ask, is this an isolated tragedy or a documented historical pattern? Which brings us to Section 3, a chronology of failures, opening the dossier.
We are going to objectively map out this escalating history of negligence from 2018 all the way to 2026. This wasn't just a single bad week for the medical infrastructure, this spans nearly a decade. We've got major incidents in Ratlam, Vidisha, Guna, and now Katni.
Let's look at exactly what happened in each of these cases, because the human cost is just staggering. Back in March 2018 in Ratlam, a complete lack of ambulances forced desperate parents to transport their 4-year-old daughter on a motorcycle for over 20 kilometers. The mother was literally holding a saline drip during the ride. Tragically, the little girl died, and doctors explicitly noted that timely arrival could have improved her chances. Fast forward to April 2021 in Vidisha, right in the middle of the COVID-19 pandemic. An ambulance was transporting a body, but the door latch was broken. While taking a turn at speed, the door flew open, and a patient's body fell right out onto the road. Then, in November 2025 in Guna, a 65-year-old man named Jagdish Oja was referred to a district hospital for chest pain. His ambulance broke down on National Highway 46 because of a simple tire puncture. And get this, the ambulance had no spare tire. Jagdish Oja died. And that brings us to April 2026 in Katni, with extortion and forced labor delaying a critical patient. Just let the reality of these incidents sink in. We are literally looking at deaths caused by missing spare tires and a complete absence of basic vehicle maintenance.
And that leads us to our final section. Section 4, the systemic breakdown, synthesizing the evidence.
We've looked at the isolated incident, and we've opened the historical dossier. Now, let's put it all together. We are left with a pretty terrifying contrast. On one hand, you have the intended purpose of the 108 service, rapid transport, safe delivery, and reliable, publicly funded healthcare support.
But on the other side, the gruesome reality pulled straight from the reporting. Missing spare tires resulting in deaths on the highway, broken door latches dumping bodies onto the street, and mothers forced to hold saline drips on motorcycles. This clearly isn't just about one bad driver demanding a bride. It is a matrix of evidence pointing indisputably to an infrastructure that is fundamentally breaking down at a mechanical, operational, and ethical level.
So I want to leave you with this question to end our explainer today. Who ultimately holds the state's healthcare infrastructure accountable when the ambulance itself becomes the hazard? It goes so far beyond a single one-week probe into a driver in Katni. If the very vehicle sent to save your life lacks a spare tire, has broken doors, or is operated by someone demanding a bribe while you bleed, well, the system isn't just failing, it is actively causing harm. It leaves us demanding accountability and, honestly, hoping for real systemic reform before another family finds themselves stranded on a highway or washing the very ambulance meant to save them. Thank you so much for joining me for this explainer, and remember to keep asking the tough questions.